16 warning signs your liver is failing. When to seek help immediately. Your liver is a busy factory that processes everything you eat, drink, breathe, or put on your skin. It performs over 500 essential functions and is basically involved in every metabolic process to keep you healthy. That's why liver failure can lead to many severe complications and even cost a person their life. It's important to spot the warning signs early so you can get the right medical help in time. In this video, we've compiled these 16 critical warning signs of liver failure. Each one could be an opportunity to get the support you need in time. Those symptoms of liver failure may be mild at first and gradually become more intense as your condition worsens. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Now let's explore the very first symptoms of liver failure. 3 earliest signs of liver failure. 1. Severe fatigue and weakness. One of the first signs that something is amiss with your liver is a profound sense of fatigue and weakness, no matter how much you rest, making it difficult to perform daily activities. The liver plays a crucial role in energy metabolism. When it's failing, your body can't effectively convert nutrients into energy, making you feel tired and sometimes nauseous. Also, when the liver fails, toxins build up in the bloodstream, which can lead to feelings of lethargy. If you often feel tired lately, make sure to get enough rest. Stay hydrated and eat balanced meals to boost your energy. Avoid sugar, salt, and fat, which can put more strain on your liver. 2. Loss of appetite and nausea. A significantly reduced desire to eat, frequent feelings of nausea, and unintended weight loss can also signal liver failure. The liver plays a key role in metabolism, and when it fails to function, our bodies can't process nutrients properly. Then, toxins can build up, leading to a reduced appetite. Loss of appetite can also stem from the discomfort in your belly caused by liver inflammation. Also, liver failure can come with a bigger or enlarged liver. It can press on the stomach and other organs, creating a feeling of fullness and nausea. Sometimes it comes with abdominal pain and fatigue. Staying hydrated, drinking ginger or peppermint tea, and consuming bland foods can help ease nausea. Try eating small, frequent meals and nutrient-packed snacks to boost your appetite. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 3. Abdominal and shoulder pain. People with liver disease can have general pain, similar to anyone else, like back or knee pain. More than 80% of those with liver cirrhosis, a condition in which scar tissue replaces healthy liver tissue, report pain. One report found almost 95% of people with end-stage liver disease experience pain. The liver doesn't actually have the nerves that sense pain, but liver disease can cause specific pain. One reason is that in liver failure, the liver's increased size can press against surrounding tissues, resulting in dull abdominal pain. The pain can also be due to inflammation in tissues surrounding your liver. This often manifests as nagging pain on the right side of the abdomen, below the rib cage where the liver is located. Sometimes the pain can radiate to the right shoulder and even up to the neck. Also, the pain in your joint or muscle may suggest hepatitis or liver inflammation from drugs or viral infection. 13 later signs of liver failure. We've discussed the 3 early signs of liver damage. If overlooked, the condition can progress to more severe stages, presenting additional warning symptoms that we will cover shortly in this section. Don't miss it. Because if these warnings go unnoticed and treatment is delayed, it may be too late, and you could face a critical situation where a liver transplant becomes the only option for survival. Yet, a liver transplant involves many challenges and is not easily attainable, regardless of how much money you have. In most countries, the waiting list for organs can stretch for years, with patients facing a difficult race against time, and many don't survive to receive their transplant. Now, this desperate situation has led to a disturbing reality in the global organ trade, one that we are determined to bring awareness to. In China, some hospitals advertise impossibly short waiting times, promising matching organs within weeks, sometimes as little as days or even hours. This unusual availability raises serious ethical concerns, as investigations have revealed a systematic program of forced organ harvesting. In a 2016 testimony to the U.S. Congress, it was estimated that China conducted 60,000 to 100,000 organ transplants each year, primarily using organs taken from detained Falun Gong practitioners who follow the tenets of truthfulness, compassion, and forbearance. Other victims include Uyghurs, Tibetans, Muslims, Christians, and other persecuted minority groups. They undergo medical testing, and their organs are harvested to fuel a large transplant industry. This practice, supported by Chinese authorities and medical institutions, is estimated to bring in around $1 billion each year. This crime has been condemned by the United Nations and many countries worldwide, yet it continues to this day, persisting for over 25 years. In shedding light on this issue, we aim to uphold medical ethics and inform our audience to avoid unintentionally supporting this wrongful practice. Early detection and prompt treatment are vital in preventing the physical pain, financial burden, and ethical challenges associated with liver failure. Now, let's continue with 13 later warning signs of liver disease that give you the chance to act early when treatment works best. Unfortunately, there's no way to fix these signs at home, so it's vital to reach out to a doctor if you notice these signs. 4. Yellowish skin and eyes, or jaundice. Jaundice is one of the most recognizable signs of liver dysfunction, marked by a yellowish tint to the skin and the whites of the eyes, or sclera. This occurs when there's an accumulation of bilirubin, a byproduct of red blood cell breakdown. A healthy liver processes bilirubin and excretes it in bile, a fluid that helps you digest food. Now, if the liver is damaged, bilirubin starts building up in the bloodstream and it ends up in other tissues, resulting in yellow skin. This is why when you have jaundice, your doctor suggests a bilirubin blood test. Normally, bilirubin in the blood is under 1 milligram per deciliter, but yellowing of the eyes is usually noticeable when levels go above 3 milligrams per deciliter. If levels keep rising, the skin may turn from yellow to green. Jaundice is more common in newborns and the elderly. It often points to liver conditions like hepatitis, or liver inflammation, sepsis, body-wide infection causing inflammation, or cirrhosis, scarring of liver tissue. Note that if only your skin turns yellow but not the eyes, it's more likely carotenoderma, a harmless condition from eating too many carotene-rich foods like carrots. 5. Dark urine and pale stools. The buildup of bilirubin not only causes jaundice, but also changes the color of your urine and stools. Your urine should ideally be clear or light yellow. If it darkens, it often just means you need more water. But if it stays dark for several days, it could be a sign that your liver needs some attention. This color is due to too much bilirubin building up and being filtered by the kidneys. When excreted this way, bilirubin increases urine concentration and gives urine a darker color, similar to tea or cola. Now, the normal brownish-yellow color of stool is due to the presence of bile in it, which is made from bilirubin. But when being damaged, the liver can't produce enough bile, leading to pale stools. If you notice your stools turning black and tarry, that could mean internal bleeding. This is a serious issue that needs immediate attention. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 6. Confusion and mental changes, or hepatic encephalopathy. Your liver is the major purifier of toxins from your blood. When your liver is failing, toxins may travel and can accumulate in the brain. The resulting condition, known as hepatic encephalopathy, is a medical emergency that can cause a wide range of symptoms. In the early stages, patients may show confusion and slight personality changes. Their mood and judgment can become clouded, and their sleep patterns might be disrupted. Some may also experience anxiety, depression, or irritability and find it hard to concentrate. As the condition progresses, confusion and lethargy typically increase. Drowsiness is common, and some may feel disoriented. Hepatic encephalopathy is often seen in people with liver cirrhosis. This condition is often reversible, but can worsen quickly if not treated, so recognizing it early is crucial for proper treatment. 7. Foul breath, or fetor hepaticus. Another common problem resulting from hepatic encephalopathy is a characteristic odor on one's breath. When the liver is not functioning well, the body's ability to convert ammonia to urea is impaired, leading to higher ammonia levels in the blood. Also, people with liver failure can have higher levels of odorous compounds in their breath, including dimethyl sulfide and acetone. This may surprise many. Your body filters blood to create saliva. So many blood components, including ammonia and other odorous compounds, are moved from the bloodstream into your mouth. When they reach the mouth, it leads to a musty or sweet smell on the breath. Some describe it as resembling the odor of a mixture of rotten eggs and garlic. Maintaining good oral hygiene and drinking plenty of water can help. However, seeking medical attention for underlying liver issues is crucial. 8. Muscle loss and twitching. Muscle loss, or sarcopenia, is common in most patients with chronic, yet not acute, liver failure, especially in patients with cirrhosis. Simply put, cirrhosis makes it hard for your body to build muscle. When your liver is damaged and can't process foods properly, your body starts using muscle for energy instead of food. High ammonia levels in liver disease are another major cause of muscle loss. Over time, muscle loss can lead to malnutrition, make you weaker, affect your ability to move, and may also affect overall health if not treated. Muscle loss may improve with resistance exercises like lifting light weights, but more studies are needed to confirm this. In severe cases of hepatic encephalopathy from liver failure, besides mental problems, patients may experience muscle twitching, restlessness, or involuntary jerking, or myoclonus. One might also notice signs like toes bending upward when the foot is stroked, or symptoms that remind you of Parkinson's, such as muscle stiffness or tremors. Some may experience slow movements and slurred speech, struggle to hold their arms steady. In rare and advanced cases, one may lose reflexes, have strange body postures, or even fall into a coma. This can be life-threatening even with treatment. Patients with liver failure often require nutritional support to maintain muscle function. For those with encephalopathy, doctors typically provide 1 to 1.5 grams of protein per kilogram of body weight daily through enteral feeding. 9. Very itchy skin, or pruritus. Persistent itching, especially on the palms of the hands and the soles of the feet, is a troubling symptom of liver failure. It is believed that the substances causing itching are produced in the liver and excreted in bile. In advanced liver disease, bile flow is impaired and bile cannot flow from the liver to the GI tract. Thus, bile salts build up in the bloodstream and end up deposited in the skin, causing intense itching. This itching tends to get worse in the evening and can be triggered by heat, menstrual cycles, or materials like wool and synthetic fabrics. Unlike typical allergic reactions, those with pruritus often don't have visible skin changes. However, scratching can cause additional skin problems that might make diagnosis tricky. In some cases, this level of discomfort may require liver transplantation. To reduce the itch, a smart tip is to keep your skin hydrated. You can use moisturizing lotions with 1% menthol for the cooling effect, or ointments. Take cool baths and avoid harsh soaps, deodorants, and scented products. But these methods are just scratching the surface when it comes to liver disease, and it's essential to consult a healthcare provider for treatment options. 10. Fluid retention and swelling, or edema. Fluid buildup happens when there's too much sodium and water in the body, mainly due to portal hypertension caused by advanced stages of cirrhosis. Portal hypertension is when blood pressure increases in the portal venous system, which carries blood to the liver. This pressure causes blood vessels to widen, reducing the effective blood volume and possibly leading to fluid retention and swelling in the abdomen, also called ascites. So, if you are thin but have a protruding belly or easily feel full, chances are that your liver is in trouble. This also happens when your liver can't produce albumin, a protein that maintains fluid balance and controls swelling in the body by keeping water in your blood vessels. With low albumin levels, tissue fluid leaks out of your bloodstream and into the tissues around it, such as your belly. This can make your stomach look swollen or large, similar to how a big belly from a fatty liver might appear. But the swelling is actually caused by fluid buildup. Swelling can also occur in the ankles or legs, indicating liver failure. To manage your condition, try a low-sodium diet and consider over-the-counter diuretics. It's best to limit sodium intake to 2,000 milligrams per day and steer clear of processed foods. They are often high in added salt. If the cause of swelling is albumin levels, stop alcohol use. Here's a simple tip. Enjoy a cup of black coffee or tea. Caffeine is a natural diuretic and can help flush out extra water. Yet don't forget to consult your doctor for treating the underlying liver condition. 11. Easy bruising and bleeding. The liver normally produces clotting factors essential for stopping bleeding. When the liver is failing or in severe cases of liver disease, the production of these factors declines, disrupting the blood clotting process. This ultimately results in an increased tendency to bruise with minor trauma and to have prolonged bleeding from cuts. Portal hypertension and swelling from liver failure, especially cirrhosis, can worsen the clotting problems by increasing blood flow to other areas. Make sure to see your doctor if you notice spontaneous bleeding without any injury. You can also support your body by avoiding any risky activities that could lead to injury. Adding vitamin K-rich foods like leafy greens and natto to your diet can give your clotting system a natural boost. 12. Vomiting blood. Portal hypertension from liver failure can cause increased pressure and swollen and enlarged veins, also called varices. They usually appear in the esophagus, or food pipe, or stomach because scarred liver tissue blocks normal blood flow. The varices in these areas can become fragile and can easily rupture, causing significant bleeding. If this happens, one might throw up blood, or it could look like coffee grounds. This is a medical emergency that needs quick treatment to stop the bleeding and prevent it from happening again. 13. Shortness of breath. Breathing problems are rare in the early stages of acute liver failure. These issues may arise later during liver recovery or due to hospital-acquired infections and aspiration. Moreover, in portal hypertension, the leaked fluid can reach and start pushing your lung, making it harder for them to transfer oxygen into the blood. Then, one may feel out of breath, and their fingers, feet, or lips may turn blue. Shortness of breath in patients with cirrhosis usually indicates a more serious condition, so these individuals should be assessed for a liver transplant. 14. Low urine output. More than 50% of patients with acute liver failure experience significant kidney problems, including kidney failure. When kidneys are failing, one may notice low urine output. Problems from advanced liver disease affect blood flow to the kidneys. Specifically, in portal hypertension, the vein and its branches in the stomach and esophagus can widen, as we mentioned earlier. This creates complex blood flow changes, where some vessels narrow while others widen. Those vessels to the kidneys become narrow, causing them to stop working properly. This condition can get worse quickly, within weeks or months. The only way to cure it is through a liver transplant. Most patients see their kidney function return to normal after recovering from liver failure. 15. Spider veins. Spider angiomas, or SAs for short, are small, spider-like blood vessels often seen in people with chronic, yet not acute, liver disease. They look like a rash of tiny dots found just under the skin's surface, typically in the face, neck, forearms, hands, and upper chest. Our liver plays a key role in hormone regulation, and SAs indicates a problem with hormonal balance affecting blood circulation. In liver failure, hormonal imbalances can lead to an increase in estrogen levels and inadequate metabolism of some hormones. This excess estrogen causes blood vessels to widen and dilate, resulting in spider veins. Although not thoroughly researched, SAs are thought to be linked to a higher risk of death in people with liver disease. Avoid alcohol, as it can worsen the condition. 16. Poor vision. In liver failure, where bile isn't working, one can't digest, absorb, and utilize the fat-soluble vitamins, including vitamin A, which plays a role in helping us sense light. A deficiency in vitamin A can cause night blindness because the eyes struggle to regenerate visual pigment. If the deficiency continues, it can cause xerophthalmia, a serious eye condition that can result in complete blindness. Also, if your eye doctor notices white or yellowish spots on your retina during an exam, these spots can indicate problems in the eye, caused by severe liver disease like cirrhosis. Portal hypertension may cause this problem, causing damage to the retina in the eye. When to seek urgent medical attention. All right, so now you know 16 signs of liver failure. Note that sometimes liver failure can come on really fast, known as acute liver failure, where your liver starts shutting down in just a few days. That's a medical emergency. In contrast, chronic liver failure, the more common type, is a slower process that develops over months or even years. If you suddenly see these symptoms and you've never had liver problems before, it could mean acute liver failure, which is serious and needs immediate attention. 1. Jaundice, or yellowing of the skin and eyes. 2. Brain dysfunction, or encephalopathy, with symptoms like sudden onset of confusion, twitching, and bad breath. 3. Abdominal swelling and pain, or ascites. 4. Edema, or swelling in the ankles, feet, hands, or face. 5. Nausea and vomiting. 6. Blood clotting issues, such as vomiting blood. 7. Shortness of breath. 8. Low urine output, especially in people who don't have disease related to the urinary tract. If you suddenly experience any combination of these symptoms, especially jaundice, tender upper abdomen, fatigue, confusion, or severe swelling, it is an urgent signal to seek medical help. If you have acute liver failure, you may develop severe symptoms suddenly, over 48 hours. Treatment requires careful monitoring in an intensive care unit, or ICU for short, along with targeted therapies and managing any complications. It's essential for all patients to be checked to see if they need a liver transplant. With the right and early treatment, acute liver injury can be reversed. However, delaying diagnosis and treatment too long can lead to sepsis, making surgery unsafe. Conclusion: understanding the warning signs of liver failure can empower you to take action early. If you or someone you know experiences the symptoms mentioned in this video, especially in combination, don't hesitate to seek help from a doctor. Remember, early intervention can make a big difference in outcomes. Liver failure can happen when your liver is overwhelmed by toxins or stress, either suddenly or over time. Maintain liver health by following a balanced diet, exercising regularly, keeping healthy weight, quit smoking, and avoid alcohol consumption. Those are all vital for reducing stress on your liver. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Just like with liver disease, the sooner you spot kidney issues, the more you can do to keep things under control. If you're unsure about your kidney health and haven't been in a good shape recently, check out the video on the screen. Here, we cover all the possible symptoms, helping you spot kidney failure and take action effectively if needed. See you there. Stay informed, stay healthy.